What is OCD? Obsessive compulsive disorder, OCD, is a mental health disorder that affects people of all ages and walks of life and occurs when a person gets caught in a cycle of obsessions and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that trigger intensely distressing feelings. Compulsions are behaviors an individual engages in to attempt to get rid of the obsessions or decrease distress. Most people have obsessive thoughts and/or compulsive behaviors at some point in their lives, but that does not mean that we all have some OCD. In order for a diagnosis of OCD to be made, this cycle of obsessions and compulsions must be so extreme that it consumes a lot of time, more than an hour every day, causes intense distress, or gets in the way of important activities that the person values. What exactly are obsessions and compulsions? Obsessions are thoughts, images, or impulses that occur over and over again and feel outside of the person's control. Individuals with OCD do not want to have these thoughts and find them disturbing. In most cases, people with OCD realize that these thoughts are illogical. Obsessions are typically accompanied by intense and uncomfortable feelings such as fear, disgust, uncertainty, and doubt, or a feeling that things have to be done in a way that is just right. In the context of OCD, obsessions are time-consuming and get in the way of important activities that the person values. This last part is extremely important to keep in mind, as it, in part, determines whether someone has OCD, a psychological disorder, rather than an obsessive personality trait. Obsessing or being obsessed are commonly used terms in everyday language. These more casual uses of the word mean that someone is preoccupied with a topic or idea or even a person. To be obsessed in this everyday sense doesn't mean that a person has problems in their day-to-day living. There may even be a pleasurable component to their experience of being obsessed. For example, you can be obsessed with a new song you hear on the radio, but you can still meet your friend for dinner, get ready for bed in a timely way, get to work on time in the morning, etc., despite this obsession. The content of an everyday obsession can be more serious. For example, everyone might have had a thought from time to time about getting sick, or worrying about a loved one's safety, or wondering if a mistake they made might be catastrophic in some way. While these thoughts look similar to what you would see in OCD, someone without OCD may have these thoughts, be momentarily concerned, and then move on. In fact, research has shown that most people have unwanted, intrusive thoughts from time to time, but in the context of OCD, these intrusive thoughts come frequently and trigger extreme anxiety that gets in the way of day-to-day functioning. Compulsions are repetitive behaviors or thoughts that a person uses with the intention of neutralizing, counteracting, or making their obsessions go away. People with OCD realize this is only a temporary solution, but without a better way to cope, they rely on compulsions nonetheless. Compulsions can also include avoiding situations that trigger obsessions. Compulsions are time-consuming and get in the way of important activities the person values. Similar to obsessions, not all repetitive behaviors or rituals are compulsions. This depends on the function and the context of the behavior. For example, bedtime routines, religious practices, and learning a new skill all involve some level of repeating an activity over and over again, but are usually a positive and functional part of daily life. Similarly, arranging and ordering books for 8 hours a day isn't a compulsion if the person works in a library. The feelings associated with the behavior also indicate whether it is compulsive. If you are just a stickler for details or like to have things neatly arranged, you might consider these things to be compulsive behaviors, but that doesn't necessarily mean they are symptoms of OCD. In these cases, compulsive refers to a personality trait or something about yourself that you actually prefer or like. In most cases, individuals with OCD feel driven to engage in compulsive behavior and would rather not have to do these time-consuming and often torturous acts. Rather than being a source of pleasure, people with OCD perform compulsions because they believe that these rituals are necessary to prevent negative consequences and/or to escape or reduce anxiety or the presence of obsessions. What's it like to live with OCD? Although many people experience minor obsessions, such as worrying about leaving the gas on or if the door is locked, and compulsions, such as avoiding the cracks in the pavement, these don't significantly interfere with daily life or are short-lived. If you experience OCD, it's likely that your obsessions and compulsions will have a big impact on how you live your life. 1. Disruption to your day-to-day life. Repeating compulsions can take up a lot of time, and you might avoid certain situations that trigger your OCD. This can mean that you're not able to go to work, see family and friends, eat out, or even go outside. Obsessive thoughts can make it hard to concentrate and leave you feeling exhausted. 2. Impact on your relationships. You may feel that you have to hide your OCD from people close to you, or your doubts and anxieties about a relationship may make it too difficult to continue. 3. Feeling ashamed or lonely. You may feel ashamed of your obsessive thoughts or worry that they can't be treated. You might want to hide this part of you from other people and find it hard to be around people or go outside. This can make you feel isolated and lonely. 4. Feeling anxious. You may find that your obsessions and compulsions are making you feel anxious and stressed. For example, some people feel that they have to carry out their compulsions so frequently that they have little control over them. OCD causes and risk factors. Doctors aren't sure why some people have OCD. Stress can make symptoms worse. It's a bit more common in women than in men. Symptoms often appear in teens or young adults. OCD risk factors include a parent, sibling, or child with OCD, physical differences in certain parts of your brain, depression, anxiety, or tics, experience with trauma, a history of physical or sexual abuse as a child. Sometimes a child might have OCD after a streptococcal infection. This is called pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, or PANDAS. OCD diagnosis. Your doctor may do a physical exam and blood test to make sure something else isn't causing your symptoms. They will also talk with you about your feelings, thoughts, and habits. OCD treatment. There's no cure for OCD, but you may be able to manage how your symptoms affect your life through medicine, therapy, or a combination of treatments. Treatments include psychotherapy. Cognitive behavioral therapy can help change your thinking patterns. In a form called exposure and response prevention, your doctor will put you in a situation designed to create anxiety or to set off compulsions. You'll learn how to lessen and then to stop your OCD thoughts or actions. Relaxation. Simple things like meditation, yoga, and massage can help with stressful OCD symptoms. Medication. Psychiatric drugs called selective serotonin reuptake inhibitors help many people control obsessions and compulsions. They might take 2 to 4 months to start working. Common ones include Celexa, anafranilin, Lexapro, and Prozac, Paxil, and Zoloft. If you have symptoms, your doctor might give you antipsychotic drugs like Abilify or Risperdal. Neuromodulation. In rare cases, when therapy and medication aren't making enough of a difference, your doctor might talk to you about devices that change the electrical activity in certain areas of your brain. One kind, transcranial magnetic stimulation, is FDA approved for OCD treatment. It uses magnetic fields to stimulate nerve cells. A more complicated procedure, deep brain stimulation, uses electrodes that are implanted in your head. TMS, transcranial magnetic stimulation. The TMS unit is a non-invasive device that is held above the head to induce the magnetic field. It targets a specific part of your brain that regulates OCD symptoms. Common obsessions in OCD. Contamination obsessions. Fear of coming into contact with perceived contaminated substances or things, such as bodily fluids, germs or disease, environmental contaminants, household chemicals, or dirt. Violent obsessions. Fear of acting on an impulse to harm oneself, to harm others, or fear of violent or horrific images in one's mind. Responsibility obsessions. Fear of being responsible for something terrible happening. Fear of harming others because of not being careful enough. Perfectionism-related obsessions. Excessive concern about evenness or exactness. Excessive concern with a need to know or remember. Fear of losing or forgetting important information when throwing something out. Excessive concern with performing tasks perfectly or correctly, or fear of making mistakes. Religious or moral obsessions. Excessive concern with offending God, damnation and or concern about blasphemy. Excessive concern with right or wrong, or morality. Identity obsessions. Excessive concern with one's sexual orientation, or concern with one's gender identity. Other obsessions. Relationship-related obsessions. Excessive concern about whether one's partner is the one, or the partner's flaws and qualities. Obsession about death or existence. Real event or false memory obsessions, or emotional contamination obsessions. On the last page, common compulsions in OCD. Washing and cleaning. Washing hands excessively or in a certain way. Excessive showering, bathing, toothbrushing, grooming, or toilet routines. Cleaning household items or other objects excessively. Doing other things to prevent or remove contact with contaminants. Checking. Checking that you did not or will not harm others. Checking that you did not or will not harm yourself. Checking that nothing terrible happened. Checking that you did not make a mistake. Checking some parts of your physical condition or body. Repeating. Rereading or rewriting. Repeating routine activities. Repeating body movements such as tapping, touching, or blinking. Repeating activities in multiples, doing a task 3 times because the number 3 is good, right, or a safe number. Mental compulsions. Mental review of events to prevent harm to oneself or to prevent terrible consequences. Praying to prevent harm. Counting while performing a task to end on a good, right, or safe number. Canceling or undoing. Example, replacing a bad word with a good word to cancel it. Other compulsions, putting things in order or arranging things until it feels right. Telling, asking, or confessing to get a reassurance. Avoiding situations that might trigger your obsessions.